White discharge is a very common symptom in pregnancy. See, discharge from the vagina, even in non-pregnancy, is actually the secretions which are coming out of the vaginal glands as well as the cervical glands. For example, if we have a cold, our nose becomes red because the blood flow over there is increasing at that time and our nose runs. We have a discharge from the nose. Why? Because of the increased blood flow, the glands over there are secreting a lot of mucus, and that is what is coming out as the nasal secretion. Similarly, in pregnancy, because the baby is growing in there inside the uterus, the blood flow to the uterus, the mouth of the uterus, which is the cervix, as well as the vagina, is increasing. So the glands over there will secrete a lot of mucus, which is what comes out as the white discharge during pregnancy. So it will be different for different women, just like different people sweat differently. There are people who sweat more, there are people who sweat less. That is not normal or abnormal. Similarly, increased white discharge is also not an abnormality, as long as none of you have itching, burning sensation, or irritation in the vaginal area. If any of these symptoms are there along with the increase in the white discharge, then we need to look and see if there is an infection. If the white discharge is too much, it is more of a nuisance, then all we suggest is a vaginal wash, which helps to keep the area clean, moisturize the area, and also because it helps to maintain the pH over there, it will prevent the vaginal infections. Pelvic pain, again, the uterus is growing from the pelvis. It is normally attached to that pelvis bone by certain ligaments, which are like rubber bands. And as the uterus grows in size, the muscles, the ligaments, everything stretches. So obviously, there is going to be some pelvic pain. As long as it is some pain which settles with a little bit of rest and sleeping, do not worry about it. But if there is some pain which is just not getting relieved, irrespective of what you do, you take rest, you try to relax yourself, then obviously you need to contact us. But some amount of discomfort on and off is quite common. I am seeing a lot of questions regarding the gynec part. Today's webinar is more to deal with pregnancy. So I would encourage a lot of women to attend the alternate months webinars where we deal with women beyond the age of 35 with gynec issues and closer to menopause to address those questions as well. As we move along in the pregnancy, a lot of people ask us, is my pregnancy high risk or is it low risk? What is high risk pregnancy and what is low risk pregnancy? How do we go about figuring out if your pregnancy is high risk or not?